Hello and welcome to News 3 New Mexico. I'm Landry Widner, and today I'm going to be speaking with Dr. Christina Sauer, who is a child psychiatrist at the University of New Mexico. I am also joined with Mr. Bobby Hurd, who is the clinical director at the La Casa Behavioral Health Services in Roswell. First, I'm going to start with Bobby. I want to give you the first question. The pandemics and the effects it is causing worldwide can be very overwhelming, and we know that people react differently to stressful situations. What are the different kinds of issues that this could create for people?
Well, as a community mental health center, we're really thinking about two separate populations. Um, One is those with severe to moderate to severe mental health issues who are really susceptible to getting sick during with mental health issues during something like this crisis. Um, the other population is people who not normally had mental health issues in their past and are not used to these kind of symptoms of depression, anxiety, stress, maybe who don't have the coping skills and don't know the resources to be able to reach out to get help in these kinds of situations. So we work on really trying to focus on supporting the patients that we have who have moderate to severe mental health issues and being available for those people who are experiencing acute issues as a result of the virus.
Right. Thank you for doing that. And Dr. Sauer, I'll go to you. Because of the lack of social interaction, we know that you specialize in children. Because of the lack of social interaction opportunities, do you think that this could alter the social and emotional skills in children?
That's a good question. I think we're trying to do a lot of preventative work with families, as from an educational level, and then when we're working with them individually around how they can best support their children. We're certainly hoping that this is a shorter term concern and, that kids will get back to more routine, even if the routine's a little different with school in the next few months. But there's the possibility that definitely children can struggle in the short run with the transitions and understanding why these changes are happening and anxiety and fear, just like adults, especially if they're not in a very supportive environment. I think that's just, more reason for all of us to be mindful, not only of our own families, but those that we know and maybe those that we work with about how we can be reaching out and, trying to support families to have as much strength as they can to try to in ways minimize the longer lasting impact that some of this has had on children at this point.
Right. And Bobby, I'll go back to you. The isolation and the fear of the unknown can be a very dangerous combination. So what would you recommend to people on how to cope with that uncertainty?
Well, I would say for the first thing is take a time out, um, disconnect from what's going on, do some normal things around the house, find some things that need to be done and you've been wanting to do but haven't had time, and do those things. Take time out to do some self-care, take a hot bath, do those things that make you feel relaxed and comfortable in your home, whether that's watching a movie on the couch with your family, um, doing things that you would normally do and feel refreshed afterwards. For some of us, it's being around people and our family and enjoying some time together. And for others, it's taking a little bit of private time and kind of recharging.
And then, Dr. Sauer, going back to you, I know this is kind of a large concern, especially now, but some children have very little structure at home and they depend on school to get away from that. What advice do you have in regards to this?
Definitely. Yeah, so it is true. Structure and routine are important for all of us, and especially for kids around, feeling like they have some sense of control and safety and helping with like self-discipline and impulse regulation. So we know those are really important things to be considering. I do think it's really valuable for families, and again, for those of us that are working with families, to be encouraging um, commitment to and consideration of routines. Of course, they're not going to have the same structure that they do at school, which for many is helpful, although for many children it can also be a stressor. So I think within the home, just trying to encourage families to be mindful of how they implement and incorporate routines around basic things like sleep, hygiene, people getting up, getting dressed, nutrition, activity. And then for those children that are now engaged online in school, also trying to build some routines around school and, incorporating that with parent work if that's necessary too. So I think you raise a really important point that school serves many functions, especially routine for kids. And so the more that we can consider, like, how can we build these temporary routines at home that don't need to be perfect and don't need to be just like school, but just need to be something that kids understand and can adapt to so that they feel like day to day they kind of know what's coming. That's definitely important for their behavioral and emotional regulation as well.
Bobby, the media coverage, talking about media, it's nonstop, and we see it everywhere. We see coronavirus, COVID-19, all of that, and it feels like it's just overtaking everything. And I know people are looking for a lot of answers. So, trying to decipher between misinformation and the truth, do you have any advice for that?
I think just take a look at the social media sites and the information that's coming in on those, and you can tell that there's a lot of people who are not doing well, who are staying on those kind of things. I think limiting your intake of news and the amount of time you spend on social media sites is probably really healthy. There could be a lot of misinformation out there. It doesn't take long to realize that when you start surfing around on these social media websites about the things that are going on. And I do think sitting around and watching the news all day can be a bit depressing normally, especially during these times.
Yeah, for sure. I definitely can relate to that. Dr. Sauer, we talked about the home conditions in the previous question for children and how they might depend on school to get away from that. Do you think there's potential for an increase in trauma due to poverty, exposure to violence, and neglect within children and adolescents?
Unfortunately, yes. Like you're mentioning, because of the factors that kids have more time at home, some families are pretty under-resourced, and certainly many are under a lot of stress right now, with potentially increasing stress if financial burdens build or people are losing their jobs. We recognize that children can get caught up in the midst of that emotional roller coaster for adults. Through CYFD and through a lot of state reporting agencies for child protective services, it seems like in ways calls and volume are down thus far, but that may just be because there's not as many eyes on kids right now. They're not going to school, they're not being seen other places where people might be picking up on this and reporting it. So that is of concern, and a piece where from a community level, we want to be encouraging people, again, within their families, communities, churches, friend circles, places that people have contact, to kind of be helping keep an eye out for families that are struggling. And, if there's children that people have relationships with, just watching out for warning signs of them being under increased stress or with significant behavioral changes that can be signs sometime of ongoing trauma. So yeah, certainly an important question, and something I think we all need to be keeping an eye out right now for.
Yes, for sure. And going back to adults, Bobby, I want to ask you, are there any recommendations that mental health professionals might suggest on how to cope with those scary emotions like depression, anxiety, or fear?
Well, I think it's a good point. Is that I think starting off first of all is being active, eating right, doing those things that are going to keep me healthy. That's a good place to start for most people. When I'm working with people who have depression, anxiety, normally one of the things that I try to get them to increase is exercise. So those things are really important to maintain, especially during these times when there's really a push to be limited on going outside. I think going outside alone or with just your immediate family and going for walks and doing things like that to stay active, I think is really helpful in kind of reducing the impact of depression, anxiety, and those things on your well-being.
Right. And then Dr. Sauer, we talked about how some families and some parents might be under a lot of stress right now. What would you have to say for those parents who have lost their jobs and are facing incredible financial struggles?
Yeah, I wish there was a nice kind of magic wand answer. I mean, certainly there's just I think for people to be able to validate and to acknowledge for themselves that this is a really hard time, that there's a lot of uncertainty, there's a lot of things out of our control. I mean, the world in many ways feels different, and we don't know when it's going to get back to what we knew it as. So I think for people to be able to take a moment for whatever they're going through and also validate that, like, that feeling's okay to have, whatever it is, if it's frustration, fear, sadness. I mean, it can, I think, be helpful for our coping to, validate those feelings. With that being said, I think as we had talked about already, it's really important for families and individuals to be looking at self-care, especially if stress is high, if you've lost your job, if you're really anxious about how you're going to get through, still trying to build time into the day that allows you to kind of be in the moment and realize, you can focus on what you can for now, doing some things that feel good to yourself. And then, I mean, I know that, through the state of New Mexico and through some other local resources, there are web pages and there are support and resource links for people to be able to access that can help with, considerations like, if I've lost my job, what do I do next? Where else can I look for other work? The financial considerations that come from that. So a mix, I think, of just being present with yourself and trying to support yourself with healthy coping and not turning to substances or other unhealthy strategies, and then hopefully using resources that are available to figure out what to do next too.
Right. And I'll stay with you on that, because another big concern right now is for those graduating seniors, college, high school. What do you have to say for them? I know they're facing a different kind of devastation right now, but also the uncertain future that they might have.
Definitely. Yeah. And it's a hard time in life to feel like you're getting stalled out, right? Because generally teenagers, high school, college students have a lot of momentum to be moving forward through their years and starting their kind of life in the independent way that they've been hoping for. So I'd go back to the same thing, that I think being able to, feel your feelings and kind of recognize what you're experiencing, some of these things we've talked about as far as anxiety and frustration and fear. And then, hopefully being able to balance that with the recognition that this will be temporary, right? Things will change, more opportunities will open. But also being able to consider, like, what can be controlled now. Are there things that you can be doing academically? Are there things that will help enrich your life in other ways that you'd like to build new skills? There's lots of online offerings now around classes and languages and other things that people can learn. So maybe directing some of the energy towards other things that you might want to be doing that aren't kind of standard academic track. And then I think a lot of families have been trying to support their children with, like, virtual prom or other things that it's not going to be the same experience, but still just trying to, like, honor and celebrate those moments that unfortunately a lot of young adults in this age group aren't going to be able to experience this year, but still, like, taking the opportunity to acknowledge that and celebrate in the ways that we can, I think, are all helpful.
Right. And we'll stick with the whole online conversation. Bobby, are there any online resources that people can turn to if need be? Can you just expand a little bit on that?
Sure. I know that I said that you should disconnect from social media websites and stuff like that, but there are some really good resources. There are some apps for smartphones that are amazing. Apps like Calm, New Mexico Connect allows you to access resources and little tools for help bringing down anxiety and thoughts of fear. The New Mexico Crisis Line can be accessed through the New Mexico Connect, which provides both crisis online services with a licensed mental health professional. It also has a warm line that that you can just either text with or call and talk to somebody. Those services are also available for people who are hearing impaired, and that's a really great resource. Another resource that's underestimated is actually YouTube. Getting on YouTube, there are literally thousands of relaxation and meditation guided imagery videos that you could get on and watch and kind of be distracted for the moment. And I often recommend those to my patients to utilize that as kind of a quick tool to do kind of a check-in and be present in the moment and kind of find out where they're at.
Well,
So that would be my recommendations.
Yeah, thank you for giving us that information. We think it's very important, and so that's why we wanted to get it out there. Dr. Sauer, this is my final question. This whole situation has proven to be very frustrating for a lot of us. And how would you suggest we control our thoughts and keep our patience and our emotions right whenever we know this whole situation is out of our control?
Yeah, that is a good question. So it's probably a little different for everybody based on, where their prior history of dealing with challenge and adversity lies, and what coping strategies work well for them, how much support they have. But I think some of the most important points are, again, I think, coming back to this, recognizing it's okay to have some of these feelings, and being able to have compassion and patience for that. I mean, certainly if someone feels like their degree of anxiety or the mood effects that they're having are impacting them negatively enough, or their function negatively enough that they need help, then definitely I recommend that they look at reaching out for more support through other people or through therapy or other mental health services. But again, self-care is crucial, right? Like, how can we take care of ourselves at this point? And then I think being aware of the fact that one of the few things we can't control is our thoughts. And so we want to be mindful of the environments we're in, as discussed earlier, like trying to limit how much anxiety provoking or sometimes negative influence we might be getting from media or social media. There's definitely a balance there. And then, I think trying to focus sometimes on what we can control, right? We're not going to be able to come up with solutions or answers to some of these things, but in the moment and through the immediate future, like, what are the things we can control? What can we plan? How can we make sure we're doing the best for our health, both physically as far as preventative care right now, but also, emotionally. So that's where we come back to a lot, and just really encouraging people that this is not there's no cookbook protocol for how to do things right now. Things don't have to be done perfectly as far as the work parenting balance, but really just trying to do it in a sustainable way that's supportive and, hopefully still balancing some appreciation and perspective on, some of the things that we do have right now and the things we can control.
Right. And I think the whole topic of mental health during this time can be pretty overlooked. And so I just want to thank you guys one more time for all of the information and the resources and the advice that you've given us. I think it's going to be very valuable.